should have had this set up before I started, but whatever. We are already here. Derp says, sorry man, I've been out. You know what? I've been out too. I just got back from traveling for 3 weeks. So my channel was a little empty over the past couple of weeks. No big deal. No big deal, Derp. Thank you for being a member. I appreciate that. David, Michael, Stevie, welcome to the stream. Appreciate it. Ask your questions, especially if you hop in first. You definitely want to get your questions in. There you go, Tony. Outlaw, hey, what's up? Thank you very much. I've been traveling for 3 weeks, so haven't checked anything. So I need to hop back on Patreon and do all that stuff. Okay. Let's see. Tony Gonzalez says, I have a claim where I did a higher level review on and they found an error and did another CMP exam for it. Okay. I just submitted an intent to file for other claims that I'm gathering evidence for and planning on submitting claims for later on this year. Would that intent to file affect my current claim in any way? No, it wouldn't. It wouldn't affect it. Maybe as far as time goes, maybe, but to be honest with you, you have your duty to assist error, which means your claim is back in it's essentially becoming a supplemental, meaning it needs new and relevant evidence. That's neither here or there though. You have 2 claims going with your intent to file, that's fine, man. Once you're ready with your new claim, right? Not your duty to assist error, but your new intent to file. Once you're ready for that, go ahead and send it in. Nothing to worry about. Lynn, Luis, Daniel, thank you for coming to the stream. Appreciate it. David Piatek with VA Housing Education. What's up? How's it going? All right, Snyder Health. Boom. Happy evening. What's up? After 2 months working on a spectacular disability package with 19 conditions, each with their own personal statement and buddy letters, I finally submitted my package. By the way, I can hardly hear you. Let me turn my volume up on my phone. Let me know if my volume's good. I'm doing this from my phone. YouTube's live stream from the phone on short form for some reason is better. So, all right, Louise says maybe this is a myth, but from what I've heard, if you have 100% for one claim and 60% for another, you are subject to extra pay. Yeah, so you're talking about housebound. Yes, SMCS, I believe. Don't quote me on that. The SMCs are... But yes, to answer your question, the answer is yes. Okay. CDB, I submitted a supplemental for my knee and ankles with personal statements, buddy letters, VA need therapy notes showing reduced range of motion and ortho current diagnosis. Do you think I'll get service connected? You're missing the in-service events. So what from service CDB caused your knee condition, right? That diagnosis that you got from the ortho. So you have all the symptoms, you have the current diagnosis, which is great, all right? The only thing in question, as from this comment only, is what is your in-service event? What is your in-service event? That is, you know, one thing, probably the main reason why I hate YouTube, okay, is creators, well, not just creators, people in the comments and everyone talks about how you can be service connected this, service connected that, but everyone overlooks the in-service event, which is required. You have to have evidence from service, whether that's medical evidence, which is preferred, obviously that would be stronger, or evidence other than medical. So for instance, one of my friends had 7 deployments, 0 complaints on knees ever, and got his knees connected because he had evidence other than medical. So my question for you, core random, is what's your in-service event? That's most important, okay? That is most important. All right. I'm sorry, that was Stevie B. All right, Coco Random says, hey Clay, denied service connection for broken foot bone. There should be an x-ray taken on board ship, but I guess I'll find out during HLR. Well, if there is a x-ray from ship, it should be in there, which would be good news. But you said during higher level review, in your decision letter, does it talk about how you have in-service events? Because that would be listed in there somewhere. David Lozano says, should I appeal my GERD claim? I fall under PACT. Also, I'm at 100% P&T. So I just let it go. Personally, I would let it go, dude. You're 100% P&T. Unless you're looking at SMCs, there's no reason at all to go for it. Plus, GERD does not fall under PACT Act anyways. Does not fall under PACT Act anyways. It can be connected via TERA, which is not PACT Act. That's toxic exposure risk activity. Yes, I've seen GERD connected on TERA. Not common whatsoever by any means. But yeah. All right, Eli Riddle. Thank you for being a member, brother. Appreciate that. Says, hey, Clay, how is it ethical for VBA to continue to send claims back to medical opinions for ACE 3 times? I have DBQ and Nexus from Dr. Sharma, and it's solid WTF. Yeah, it's pretty wild, isn't it? I'm going to make, once my battery is charged, I left my batteries where I was traveling, so I had to buy new batteries. I was going to do some recording today, whatever. But once it's charged, I'm going to hop on this. And CMP exams are under the hot seat from Senator Warren, right? Of all people, since Senator Warren. It's got something to say about these CMP exams. So, more to follow on that. But it's not, to answer your question simply, it's not. All right. New member, J. Cole. I love that name, right? J. Cole, one of my favorite artists. What's up, man? Welcome. Welcome. All right. Omar Gonzalez says, plantar fasciitis continued at 10%. I have a letter from my podiatrist stating insoles and injections did not provide relief, and he will not perform surgery. Should I try for an increase on 30%? Let me be very specific here, because plantar fasciitis, 38 CFR, ECFR. Let's go take a look. Let's go take a look at plantar fasciitis. Excuse me. All right, 5269 is the rating code for that. At 30%, it says no relief from both non-surgical and surgical treatment, bilateral. 20% is no relief from both non-surgical and surgical treatment, unilateral, so just one. And then otherwise unilateral or bilateral at 10%. So loss of use is rated at 40%. And then there's a second note below that. And if you're wondering what I'm looking at, I'll just show you from my phone here. It's 38 CFR, plantar fasciitis. Just Google 5269 plantar fasciitis. Do a control F. You'll find this, okay, on ECFR. If a veteran has recommended for surgical intervention, but is not a surgical candidate, which is you, okay, evaluate under the 20 or 30%, whichever is applicable. So essentially what you're saying, because he will not perform surgery, I want to know if you're a surgical candidate and for some reason he won't perform surgery. If you were, I think I read a YouTube comment about this, maybe you're the same person. If that's you and your doctor said because you're too old, then you would be a surgical candidate and you should be rated on 20 or 30%. And that seems like a pretty easy higher level review. All right, we have another member. Thank you for 2 members, I appreciate that. Tracy M, what's up? Welcome to the rank of Lance Corporal, leader of the cleaning people, as I like to say. Welcome. How's it going? How is it going? You know what I want to do? Before I answer more questions, let me just move my phone camera to this side. I want to see if it looks any better. I'm trying to redo my background at the moment. Nah, you can't see it. But you see this right here? A fan of the channel made that for me. So very, very pumped about that. Very excited. Thank you very much for who did that. Okay, holy baloney, dude. Wow. I never know what to say when this happens. Thank you, dude. I feel very, very, very weird. All right. Pie High Marine says, thanks again for the help. I would also like to pay it forward to a fellow vet by funding one for one of Dr. Sharma's DBQs. Shoot me an email letting me know what to do. Yeah, so we did that before and it was great. If you guys remember, B-Buck sponsored a veteran for to have a medical opinion, which was awesome. Okay. Yeah, B-Buck did that. It was beautiful. Go ahead and do this, Pie High, because I don't know your email off the top of my mind. Can you shoot me an email and in the subject line, gotta get my Darth Maul on there. In the subject line, can you just say, you know, Dr. Sharma DBQ donation or however you want to word it in the subject line so I can star your email. And then from there, we can go ahead and talk details and I'll get with the doc for that if you want to go that route. But yeah, that would be amazing. And thank you very much, brother. Right? I'm going to assume you used that service and it helped out. So, holy bananas. Okay. Let me see if there's any other member chats. There's not. Okay, let's get back to answering questions. Spy high, dude. Thank you. Appreciate it. All right, Seismic Soldiers says, I'm 100% P&T. I filed for ED. I'm a little stressed because I'm opening up my claim. Should I be worried? No. Seismic, I'm going to assume you filed your PTSD, your erectile dysfunction secondary to like medication or something like that. If that is the case, I have no idea what's happening. If that's the case, man, you're fine. Don't worry about it. Super easy. SMCK. Can someone tell me what's happening? Is that spam? YouTube Live, they just updated their stuff and I don't know what's happening. CBAX gifted. Dude, thank you. I think I know what that is. If that's the case, thank you, man. Appreciate it. Okay. Yeah, I don't know what happened, but thank you. Thank you, man. Okay, I totally understand what's happening now. Damn, dude. I don't know what's happening today, but it's pretty awesome. Jose Villa, thank you for the $2 donation. I appreciate it. If you have a question, please ask me. Help, I did it all on my own too. Okay, Jose, I got you. Jose says, CBAX, dude. Wow, man. All right. Jose says, hey, bro, just want to say that I got my rating increased to 90%. Had my final exam today for nerve damage on my left arm. Hopefully that will be enough to push me to 100. Thank you for your videos. Hey, awesome to you, Jose. Right, I'm a huge fan of VSOs, personally. And then when needed, which is rare, well, it's uncommon, I won't say rare, then I would go the attorney route. But awesome, congrats to you, dude. CBAX, man, thank you very much. Tracy M, I got you. Damn, dude. Wow. Okay, let's get back to answering questions here. Tracy M says, going great. Do you need your service treatment records for a fully developed claim? No, you don't. You just need to have them in there. Personally, so you don't need your entire STR, right? If I'm claiming migraines, I need my migraine evidence from my service treatment record. I'll pull it out, right? And then submit it in a package to the VA with my in-service event, my current diagnosis, my current symptoms, right? And a DBQ filled out by your primary or your referred care. That would be the fully developed claim. At a minimum, we want the in-service event and the current diagnosis submitted, okay? Tracy M says, I'm already service connected but don't have my C file, which I'm waiting for. My intent to file expires next week. In that instance, Tracy M, because you want, and this is the only time I recommend this, okay? Because you want to reserve that date before your intent to file runs out, okay? And do it a day before just to be safe. A day before your intent to file runs out, submit everything and just get it on the books. And then if you need to, submit evidence later on. In worst case scenario, you don't have the evidence by that time, you're denied, but then you can appeal it and preserve your effective date, okay? That's the only time I ever recommend going that route. All right. Derp Turkey says, I recently found out I had reflux. I'm going to the doc. I'm so active duty, and they'll prescribe me something. Anything I should know for acid reflux? No, not really. Go ahead and do your thing. You're talking about GERD. The issue is because you're active duty, May 19th, the changes go into effect, and that will no longer be rated as a symptom of GERD, which sucks. Okay. But regardless, submit it anyways, okay? Let the VA do VA stuff. Okay. Chris Gutierrez says, I just want to say that you're the man and that I speak on behalf of all veterans. You are the man. Thanks. Thanks, Chris. Appreciate it, dude. All right. Ryan Thomas says, filing a claim for PTSD. I got you, Billy. Seeing private psychiatrist, combat action badge, and combat award. I'll ask private doc for DBQ. Should I ask for Nexus letter as well? I wouldn't do a Nexus in your case. I'm going to assume that your in-service event stems from combat. And if that's the case, don't sweat it. The DBQ is solid. I wouldn't pay for one in your case because you seem like you have all the evidence. But if they're willing to do it for free, absolutely get that DBQ. And in the remarks section, if you want, ask your private psychiatrist to just put a Nexus opinion in there, like at least as likely or more than likely caused by your in-service stressor, okay? All right, Billy Hartman says, is there a good service that can read the old handwritten SDRs from the 90s or earlier? I have no idea on a service like that, but reading doctor's notes is definitely an art. I'm not sure of a service that is particular for that, though. All right. Keith and Jennifer Wickoff. I asked earlier about claiming one secondary to 2 service-related conditions. It's sleep apnea, service-connected conditions, or PTSD and rhinitis. I know PTSD and OSA hard to get one to get. Yeah, you can do that. Those are both correlating factors. The VA is going to do VA stuff. That's a perfect example. But your evidence would indicate where it's stemming from, okay? So if you claim sleep apnea secondary to PTSD, the VA is going to look at all correlating factors to include rhinitis and all your other correlating factors, like if you're obese, if you breathe in heavy particulates, if you're on medication like gabapentin, all those are correlating factors, okay? The VA will handle that. TC, thank you for the donation. I definitely appreciate it. Says, I'm trying to file for PTSD deployed to Iraq and Afghan and Bahrain. I was a pig, but experienced no combat. What are my chances of getting a rating? Yeah, so you don't need combat for PTSD, okay? PTSD stems from, dude, you're wild. PTSD stems from other things, not just combat, right? There's obviously combat related, but then there's others as well. As far as what are your chances being rated, there's no way I can speculate on that. I would like to know what your in-service stressor is, right? What is your in-service event? Are you even diagnosed? What does that look like for you, right? You can't say my stressor is all of my deployments. We're talking about events here, okay? And I would really try and narrow down your events. It could be multiple events, but I wouldn't say like, you know, my entire life. Okay, thank you very much. Pie High Marine, man. Just want to see you uncomfortable again. Have a drink on me. Yeah, appreciate it. Seriously. Thank you very much. There you go. This is me uncomfortable. All right. Oh, you said pogue, not pig. Yeah. I thought you meant pig as a sniper pig. Pigs and hogs. Okay. No big deal, TC. Okay, Joe B, thank you for being a member. 1996, my wife and an African American had incidents where they were severely discriminated, and she also had sexual harassment. The top chief and supervisor lost stripes. What can she do? Mental health. Yeah, claim. It sounds like MST with sexual harassment. I would absolutely claim it. I would absolutely claim mental health, especially if there's any evidence, right? Of the event happening, go ahead and submit that with that claim. All right. Okay, here we go. Let's roll. Let's see, we were at Omar Gonzalez. Currently have a 7% rating for mental health. Under the old criteria, should put in for an increase and possibly get 100%. So one, the new criteria is still proposed. There's no final date on that, right? Now, I've been out for 3 weeks. That could have changed. I don't think it did, but it could have. Now, as far as you going from 70 to 100%, that's based on your symptoms. I have a video on how mental health will be rated under the proposed criteria, and it really explains the levels of domains that you would need for 100%. So watch that, check that out. You'll see where you fall at on the scale. Miguel Lugo says, I have 20 active diagnoses and 16 inactive. Can I claim inactive as well? Yeah, so for BDDs, all the stuff that you hear on YouTube does not apply to you, okay? Here's your one over the world for BDD claims. Benefits delivered at discharge, your active duty, you have 180 to 90 days to submit them. All you need, right? All you need is a current diagnosis. Last minute, the current diagnosis can be given by the C&P examiner. Obviously, you would want medical evidence and a diagnosis prior to that. That would be ideal, but it's not required, okay? So for instance, if your knees hurt, that goes on your BDD claim list. If you have no evidence of knees, but you know they hurt, claim knees, right? Let the VA do VA stuff. BDD is like the magical wand that only applies to you in this one moment, so take advantage of that. All right. Okay, we got some member chats here. Joseph Rottenberry says, I also got rated for my back at 20%, but the C&P examiner did only one measurement of back flexion, and it was 12 degrees. Should I ask for higher level review? The examiner approved a long shot claim of right knee. It depends on what your range of motion is, right? If you're implying that had they measured again, it would have been different, then sure, you can go that route. It doesn't seem that way based on this comment, but you could, okay? And then you're saying your right knee secondary to left knee. That is a long shot claim, I'll tell you that. Okay, Tracy M says, filing for hiatal hernia and migraines. Should I claim GERD also? I have symptoms of GERD. VA doc gave me a Meprazole, which says, Trey, absolutely. Let the VA do VA stuff. You can file all of that, right? Don't sweat the VA stuff. Let them do their thing. All right, here we go. Let's get back to Anthony Rivers. If service connected back, then service connected radiculopathy secondary to back. Can you get a rating for hip pain secondary to the radiculopathy? I think your back would be the more plausible route. Now I'm gonna be real with you. Hips are largely, overwhelmingly 0%. The range of motion is so wide. I think it's 45 degrees for 10%. Don't quote me on that. Look it up. But you can, absolutely. Right, you're going to need evidence indicating the secondary connection, but you absolutely can. Tammy D with the $50 donation. Thank you for what you do, Civ. Thank you very much. I don't know what is happening today, but today's a good day. Okay? Today's a good day. Thank you very much. Seriously, appreciate it. Tammy D, if you have any questions, let me know. I'm here for you. I am here for you. You have my full attention right now. Okay? Thank you very much, Tammy. Wild. Concerned observer says, if I have nerve damage caused from repeated ankle sprains due to chronic ankle instability, is that two separate ratings or are they combined? Nerve damage from ankle sprains. No, so your ankles will be rated on range of motion, right? Or the loss of use, which is essentially just hardcore range of motion. And then you have nerve damage. You can receive up to 5 ratings within your legs for nerve damage, right? But nerve damage in your legs and your ankle range of motion are 2 separate disabilities that you can be rated. Okay, Joseph Rottenberry, thank you for being a member, says, just got rated 20% for gastric ulcers with gastritis, 7304 applied for GERD, but C&P examiner went back to in-service diagnosis. I do have a current diagnosis for ulcers. What should I do? Your service connected, I wouldn't sweat it at all, Joseph. I wouldn't sweat it at all. And looking at, I'm going to assume your symptoms aren't lining up with the new GERD ratings. So to be honest with you, I think I would just relax and chill on the gastric ulcers. All right, today is a heck of a welcome home. Yeah, man, I've been out for a few weeks traveling for work, and thank you very much, everyone. Appreciate it. You're absolutely right, Billy. Yeah, Joseph. The real answer is it doesn't matter. I would drop it. It's what I call VA doing VA stuff, right? We don't have to tell them to do it. They just kind of do. Okay. A new You Awaken says, hey, my claim is in the 5th phase. They didn't send me the C&P exams for everything out of 13 things. I went to C&P exam for 6. Also provided exact information. My exam was short. Okay, so if you had evidence, it's normal for exams to be short. The VA should just require the C&P examiner to get what they need, right? As far as your other claims, they could very well be deferred, meaning the VA has a decision ready on, the first 6 claims, and the next 7 claims, they need more time, so you could get a decision, and then the other 7 would be deferred, which is neither good nor bad. It just means they need more time. That's what it sounds like is going to happen, versus a denial straight out. But there's a lot of context that I'm missing to answer that question. All right, Israel Maldonado says, I was given 10% for GERD with esophagitis, dysphagia, and chronic gastritis secondary to neurological PTSD. So a lot of GERD symptoms with a diagnosis from my private provider. Should I request HR or supplemental? You know what I would do is I would do a supplemental, gather your evidence, okay, and really look at the new criteria for GERD, right? I have a video on that on the playlist VA Disability Ratings. Look at the new way GERD is rated. It sounds like you're going to be rated higher than that, but obviously there's context from this one comment I'm missing, Modernado. So go ahead and check that out, right? But that's what it sounds like to me. All right, Steve Simber says, is IED intermittent explosive disorder a claimable secondary symptom to PTSD? I didn't even know that was a condition, but let's go look at it. I'm gonna say it would be a symptom under there. The symptoms would line up the same because you're not gonna find a diagnostic code for that. The VA would find one for you, which is probably gonna be PTSD. But I'm curious as to what that even says. IED, intermittent explosive disorder. Yeah, behavioral disorder at 1,000% going to be mental health. If you're already ready for PTSD, I wouldn't sweat it. Jacob Taylor says, I have my mental health CMP and next CMP tomorrow. Any tips? Yeah, Jacob, I do actually. Lucky for you, you can go look out how the back is rated. It says lower back pain, but it's the spine. It's the exact same for the lower spine and the cervical spine, right? Or the neck. Same. And the radiculopathy, instead of being in your legs, would be in your arms. As far as your, mental health, I also have a video on how mental health CMP exams will go. You definitely want to check that out, right? I wonder if I'm able to link videos in the chat here, although I don't think you'll be able to click on them because the YouTube Shorts feed is weird, but they did do some massive updates. So let me just try this out real quick and I'll get back to answering more questions. YouTube's been putting a lot of work in their short form content lately, and I am very happy for that. Okay, I can click it on the computer. I'm hoping that you can click it on your phone. But that's the mental health CMP exam. And the spine one, which remember, this is for lower back, but it's the exact same for the neck, just it's on the same DBQ and everything. Okay. Cool. Let me see if I have any member chats that I missed. I don't think so. All right. Tammy D, thank you very much again. Seriously. Pi High Marine, C-Backs. I mean, everyone that joined as a member, dude, wild. Okay. Absolutely wild. Thank you very much. All right. Military Mike, 74 Delta U.S. Army National Guard, 31 years. What's up? Respect to you, man. Welcome. Judy Romero, what reference are you using to look up information? Yeah, so the easiest way to look at how disabilities are rated is to go to Google, right? I'm going to try this. It's probably not going to work out on the phone. I'm just going to try, okay? Hopefully you guys can see. This is how you figure out how the VA works, okay? So let's say you want to look at mental health. You type in mental health, 38 CFR ECFR. This is whatever condition you wanting to claim, okay? Let's say you want to claim acid reflux. Now we know that's GERD. Let's just call it acid reflux so you don't have to understand everything. Then hit enter. Bam. Whatever the ECFR link is, that's what you click. And then once you're here, you control F and you can go ahead and look at your stuff. So there we go. There's gastro, and you can find all the gastros with a control F and find that condition. Super easy to do. That whole thing showing you took me about like a minute. So if you have any questions on how things are rated, that's exactly what I do to figure out how things are rated, and that's the reference that everyone uses. Okay, 38 CFR. You don't have to understand the ins and outs of the M21 or all the really nerdy VA type stuff. All you have to understand is your claim. That's it. All right. Russell Hurt says, how do you connect sleep apnea secondary to PTSD? Yeah, very difficult, Russell. You got to have correlating factors, okay? The more correlating factors you have, the better your claim is, right? So let's talk about correlating factors. PTSD is one correlating factor. If you have other respiratory conditions like sinusitis, rhinitis, bronchitis, asthma, those are correlating factors, very, very strong correlating factors. If you are obese, right, now your obesity has to be recognized by the VA stemming from service, all right? I have a whole video on obesity that you can check out as well. But that's a very, very strong correlating factor. If you took in heavy particulates like around burn pits, that's another correlating factor. And then medications like gabapentin or other medications that are causing obesity are all correlating factors. The more you have, the stronger your claim is, right? So you're never going to see a more than likely sleep apnea secondary to PTSD. It should always be at least as likely, right? Because there's no causative link, it's correlation based. Can primary doctor diagnose sinusitis without CT scan? They can, but they're going to want a CT scan for healthcare treatment anyways. All right, military Mike, my health eVet Blue Note has my service connected for somatization disorder at 70, but I filed for insomnia and was rewarded 70. Are they the same? Yep, military Mike, they're the same. Don't sweat it whatsoever. Outlaw, thank you for being a member. And Outlaw says, hit the thumbs up. I appreciate that, brother. Thank you very much. If you, this is added value, right? If you like this stuff, hit the thumbs up. It helps the channel out, and it helps veterans see this, okay? Helps veterans see this. Okay, Judy Romero, thank you very much, Judy. I appreciate that, right? If you have a question, let me know. Let me know below. Thank you for the super sticker. Appreciate that. Okay. Oh, Judy, thank you. Yeah, the 38, Googling, your condition in 38 CFR, ECFR is the way to go for everything. I'm probably going to make a video on how to do that just to make it Barney style so everyone can see it. We can absolutely do that. All right, GG says, I have GERD and I have idea where I got it. I've been on 2 MUs to Southeast Asia and the Middle East, and as well as SP MAGTF to the Southwest border. Any thoughts? Yeah, do you have any medical evidence? Because that would be a lot stronger. I'm not saying yours is, well, you don't have medical evidence based on that comment. You have evidence other than medical, which is present. It seems weak, though. I want to know, did you start having symptoms while you were in? Were you taking, like, Motrin and stuff like that for your symptoms? Is there any medical evidence of you getting medication from the corpsman? I assume you're in the Marine Corps because you said MU. What does that look like for you? Side note, you see this thing here? Someone made that for me while I was gone. I just hung it up about 30 minutes ago. So, thank you very much. His name is Lucas. He does tattoos. I'm actually probably going to link his tattoo stuff. Obviously, I have lots of tattoos, okay? All right, I should probably give him a shout out. Lucas Brawley. Can I link his? I can't. Okay, I'll figure it out. Edwin 228. I got denied TBI. I sent service medical records with the event of the TBI plus current diagnosis plus symptoms and private Nexus. They claim that I did not seek medical help while in the service. What can I do? I submitted Nexus from private doctor. I would do a higher level review immediately. Now, there's some context that I need to know before giving any sort of solid advice, but assuming your Nexus is solid, right? And I would really like that to come from a neurologist or a psychiatrist at a minimum. If that's certainly the case, then HLR. But what from service led to your TBI right now? What's the time gap? We're talking 20 years and no medical evidence? That's pretty hard, okay? I'd be surprised if anyone writing a medical opinion for that in the first place, which gets back to my point. I'm curious as to what your Nexus actually is, okay? So tons of questions I have for you, Edwin, but assuming all that's solid, I would do a higher level review. Jose M. Figueroa, I'm sorry I butchered that, says, hey everyone, I'm new to the channel. What up? How's it going? Yeah, you got out in 2001, Edwin. That's going to be difficult, okay? Definitely need to understand what is your evidence from service. Did a fall happen? Were you around really constant, like charge 5 howitzers for a long time? I mean, what led to your TBI from service, okay? And if you have that, personal assault, then I would do a higher level review, okay? Higher level review, especially if you have like personnel records or anything indicated that the assault happened, 1000% I would. All right, Runaway Rick says, I'm here to say thank you. Thank you, dog. What's up? Jose says, I stumbled here and got a blank. Anyone has anyone has any kind of info about presumptive disabilities? Yeah, presumptives are super easy, okay? Super easy. All you need to do is meet the criteria for the presumptive, whether that's time-based or location and time-based or location-based, and then have a current diagnosis. That's it. Nothing else. Don't overcomplicate it. Meet the criteria, get a current diagnosis, submit the claim. Easy peasy. Joseph Rottenberry, thank you for being a member, says, on my back claim, the VA said there was no in-service event or complaints. When I got C-file, found complaints, and just got it approved. Thanks for your help. Yeah, there you go. I don't think so. Qs are not what you're implying right here. It's definitely a mistake. Okay. If you're gonna do, see, it's hard to say without looking at the evidence. If you want to go that route, depending on what the pay would be for you, Joseph, I would go ahead and seek a lawyer. If you're doing a Q, you need a representative for sure. Okay. That's my advice personally. You don't have to do that. That's just my recommendation. But I'm glad that you actually got service connected, and I'm glad that you requested your C file and found the complaint. So good on you for that. Just looking at the time frame of the C file, it's definitely possible for you to have back pay on that. So that might be something you want to look into. Maybe. Context is everything. All right. Let's see. David Dottie, keep up the good work, Clay. David, thank you very much. I appreciate that. If you have a question, let me know. Let me know down below so I can see it right now. Thanks, man. Seriously. All right, Concerned Observer says, would you happen to know if knee pains are a presumptive to being a paratrooper? Yes. My knee pain was service connected on my exit exam for my med board back in 2016, and that pain still persistent. Oh, dude, you have a med board. That's a super easy claim, okay? Super easy. Submit that. I would look at back. I would look at all your other joints as well, right? Thank you very much. All right, David Dottie, thank you very much. And option C with a $10 donation, man. Thank you very much. Welcome back, Clay. No questions. Just happy to support the awesome work you're doing. Thanks, man. Appreciate it, for real. Seriously. Thank you. Yeah, I've been out for about 3 weeks. Now I'm back, just hanging out. All right. Concerned Observer says, would you happen to... Oh, got you. Jury Duhan says, can my federal job fire me because I have PTSD? No, they cannot. I'm a federal employee. No. Now, can they fire you because your PTSD is making you do some wild stuff in the workplace? That's a different story, okay? But just having the condition, no, not at all. Slow to respond. I love that name. Wanted to say thanks for everything. Also, quick question. Is an ACE exam for PACT Act migraine generally a good sign? Yeah, so if you have an ACE exam for anything, it generally means you have the diagnosis and you have the evidence. It just requires an opinion, right? So if you have the diagnosis, you have the evidence to include symptoms. They're just looking at the opinion. It's probably going to end up in an ACE. It's not good and it's also not bad. It's just it's neither. It's irrelevant. Okay. It seems like you're looking at MU-CMI for migraines, which could be. Just depends. All right. Rob Ogletree says, Dirt, thank you very much, by the way, for being a moderator and answering questions, man. Appreciate that. Rob Ogletree says, can a static 70% PTSD be upgraded for MST? The 5-year rule has been met. MST is an event, not a diagnosis. Okay, one. Now, getting back to the diagnosis, which is PTSD, if your symptoms warrant an increase, then sure, but that really has nothing to do with the event that happened, because that was before. Symptoms are now. Okay. Board Game Officer, thank you very much for the donation, says, I got out less than 1 year ago. Just got diagnosed with sleep apnea. I talked about being tired at the end of service. Should I go primary? I would, absolutely. If you're within the first year, okay, I would file anything you're diagnosed for. I would file it, right? Let the VA do all the VA stuff. Get those claims out. That's what I would do personally, right? The BDD claim is its own kind of special little magical trick, right? That service members have. The 1 year window is another magical trick that veterans have. After that 1 year window, you're in the game with the rest of us, okay? But in those two time frames, you really want to take advantage of everything board game. So, all right. Keith says, I'm trying to claim sleep apnea secondary to PTSD, but the VA is my primary. How do I get a Nexus without paying? Yeah, you can ask your primary care, right? You can go to private insurance and go that route. But other than that, that's it. All right, CA, can you recommend a Nexus doctor? There's a few in my descriptions. I don't generally recommend any Nexus letters unless these two are true. Both of these are true, okay? One, you've been denied, and two, you have the evidence. That's me personally, right? Can you submit a claim or with a Nexus on top of your claim up front? You absolutely can. I don't recommend that, right? But you can. As far as the Nexus letter doctors go, they're just advertisements in the description. If that's what you want, go for it. But you can find many out there. So it just depends. All right. Jose Villa. Oh, got you. Okay. Daniel Goody says, my VSO told me that my personal statements that explain inserts events and how it medically affects me are not needed if I don't have a diagnosis. Do I still submit those papers or wait? Yeah, you're going to want, so your VSO is, I would say, half right, okay? You're going to want your diagnosis. That's hands down, you're going to need a diagnosis. Now, your statements talking about your in-service events and your current diagnosis is solid. But again, no diagnosis, no claim. So, got to get the diagnosis. Art Nelson with the $5 donation. Thank you very much, Art. If you have a question, let me know below. I see you didn't type anything up, but no big deal. I'll keep an eye out on here for you. So, if you have a question, let me know, man. Okay. Carmen Williams says, so TERA and PACT, two different things. Explain, please. Yeah, so you have TERA, which is toxic exposure. I got you, Art. 1 second. Yeah, let me highlight this. TERA is toxic exposure risk activity, which requires an opinion. PACT Act are presumptive disability, or it's a piece of legislation that includes conditions that are conceded by the VA as presumptive, meaning you don't need an opinion because the VA says, hey, if you got these, you're good to go. TERA is if you got these, that sucks. It probably came from here, but we have to do some digging and give an opinion. That's TERA and PACT Act, okay? Yeah. The good news is you don't have to know any of that. All we do is submit the claim. So submit the diagnosis, submit your evidence as to where it came from. That's going to be on the TERA piece of the side of the house. Let the VA do the rest. All right, Art Nelson says exposure to potentially hazardous substance documented April 2024. I have no idea what your question is. But you're exposed to something. You have a treatment code in there. If you have a diagnosis, I would go ahead and submit the claim. Leave it at that. Leave it be. All right. I love how Pi Highs and Tammy D's stuff is still up there. Thank you very much. Appreciate that. All right. Corey PA with a super sticker. Thank you very much, Corey. Now, if you have a question, put it below, because I see you didn't type a question up in there. No big deal. But if you have a question, type it below right now so I see it. Okay. Do you see any changes to the sleep apnea? Yeah, they're coming down. We just don't know when. It's not really favorable unless your coexisting conditions prevent you from wearing the machine. If not, and you can wear the machine, it's not good. It's not good at all. But yeah, I have a video on that as well in my VA disability ratings. All right, Angela Corsino says, all my service connected are static. What does that mean? It means that you are not due for any future exams. So whatever percentage you're at right now, it's quote unquote safe. You're good to go. All right, Corey PA says, I'm filing BDD with retirement 1 October. How do I know I fall under new or old ratings? Yeah, Corey, here's the real answer. I'm going to answer your question, okay? But before I do, I want to say it this way so you understand the concept. One, it doesn't matter. It doesn't matter if you fall under the new or the old or both. What matters is you submit the claim. Because the VA is going to do what the VA is going to do, and you have no control over that. No one has control over that. It's our job to submit evidence-based claims. Now, you have enough time before October to get in what you need to get in, okay? Which is good, but I'll go ahead and answer your question. So for GERD and IBS, and there's a few others on the GI tract, okay? You're going to fall under the new ratings. That's it. New ratings, you can kiss that goodbye. GERD, not so favorable unless you have the tightening of the throat. IBS is favorable with a 10, 20, and 30%. Israel, I'll get to you in a second. Thank you. Now, as far as your other ratings, like tinnitus, don't sweat that. Tinnitus is not going away, right? It makes for a good thumbnail and title. It's not going away. I have a whole video on how the tinnitus changes are good, because it's going to be wrote under hearing loss, vertigo, essentially, or other neurological disorders like TBI and stuff like that. So it's not going away. And the VA rates symptoms, not the diagnosis, FYI. For mental health, they're favorable, so that one really doesn't matter, right? For sleep apnea, that one sucks. And these are we're assuming that these are final, which they may not be, okay? But if the final effective date is after you submit your BDD claim, then you'll be rated on both. If it's before, you'll be rated on the new. And if it's after, you'll be rated on the new one. Does that make sense? Okay. Israel, thank you very much for the $10. Appreciate that. Says, thank you for all the information you provided with all the videos you put on YouTube. The videos have been very beneficial, and thank you for answering my questions. Israel Maldonado, thank you very much. I appreciate that, man. Seriously, I do. That's awesome. Oh man. Okay, thank you. Frankie Val. Okay, hold on. We got a lot of stuff happening right now. Let me go in order. John Sullivan says, I'm sitting at 94%. Can I get bilateral factor for 50% bilateral fee condition? It's already added in there. But if you're at 94, I would totally look at the 5 steps. John, thank you for being a member. The increases, secondaries, denials, new conditions, and presumptives, and really see what you can be properly rated for. Okay, Frankie Val, thank you very much for the donation. Appreciate that. Oh, John, you didn't have to do that, man. Thank you very much. Thank you for being a member and for donating. Appreciate that, man. Elijah Frees says, thank you for the donation, Elijah. Appreciate that. If you have a question, please throw it down. I really need to, whatever. Anyone who does donated, if you have a question, I need you to put it in the chat now so I see it. I don't want to skip over you, okay? Man, for you, John, do me a favor, John Sullivan, send me an email, okay? Actually, don't do that. Whatever. Already put it up there. Send me an email. Subject line, just put your name or your YouTube name, John Sullivan, and I will talk with you. At 94%, man, there's got to be something there. Send me an email. I'll send you a short questionnaire, and we can kind of just go back and forth quickly for that. I can at least give you my 2 cents on your situation. Okay, Mike O'Brien says, can you do an intent to file for GERD even if you have an open claim for other things? An intent to file is an intent to file. It ropes all claims under that, right? So there's not an intent to file for tinnitus, an intent to file for GERD, an intent to file for everything else. It's kind of just an intent to file. Whenever you submit whatever it is you're going to submit, it's gone. Then you can do another one for a new batch, but that's it. Okay, now there are so many questions on here that the chat is kind of being bumped down. Doc Feelgood says, love that EGA. Yeah, man. A fan of the channel, Lucas Brawley, who does tattoos, okay, made that for me. So I'll have to get his information, his Instagram account and all that stuff and start linking it. Absolutely. Stevie B, dude. Oh man, you guys really want to make me feel uncomfortable. I appreciate that, Stevie, very much. Thank you, seriously. Stevie says, is rhinitis a presumptive condition for heavy equipment operator? Marine Corps. No. No, it's not. Okay. Now, is it possible that some of the equipment you used or cleaning materials, I'm not really sure for heavy equipment, what you were exposed to could cause rhinitis under TERA, meaning not presumptive, but it does require an opinion for toxic exposure? The answer is yes. For presumptive, being a heavy equipment operator engineer, that answer is no. For rhinitis, and I'm just going to look up PACT Act VA right now to give you the dates, because if you deployed in the Marine Corps, to include a MU, okay, Southwest Asia, like the Red Sea, Gulf of Aden, Gulf of Oman, all those count, right? So on or after September 11th of 2001, Afghan, Djibouti, Egypt, Jordan, Lebanon, Syria, Uzbekistan, Yemen, or the airspace above, to include like the Gulf of Oman, Gulf of Aden, stuff like that. I assume you fall into one of those categories. But if not, to answer your question, the answer is no, not presumptive, but it can be connected via TERA, right? Two different things there. Okay. Thank you very much, CVB. I hope that answers your question. If not, let me know in the chat below, okay? And I can absolutely get back to you. Shadow Master says, I'm at 90% trying to make it to 100. Yeah, so going from 90 to 100, really going from any percentage to any other percentage, there's 5 steps you need to do, right? And if you look at my one-on-ones, I go through these steps. It's the same template I use for everyone, okay? There's a whole playlist on one-on-ones, and I'll be adding to that. But first thing I do is look at increases. What are you currently service connected for, and what are your current symptoms? That's the easiest. Then I look at secondaries, not so easy, right? Are there any conditions stemming from your service-connected disabilities? Then I look at denials, also not so easy. What were you denied? More importantly, why were you denied in the first place? And then third is, can we get evidence to combat the reason for denial? Maybe. Then the fourth thing I look at, so increases, secondaries, denials, then I look at new conditions. So if there's anything that you missed, you'd be surprised at how many veterans are like, well, I talked about my knee, my knee strain in service, but I never claimed it. And then I would be like, well, let's go ahead and submit that claim right now, okay? And then the fifth thing is presumptives, especially with PACT Act. For some reason, people just aren't submitting presumptive claims. I have no idea why, but a lot of veterans are not. A lot of veterans are, but the opposite also applies. So that's the 5-step process, okay? Doc says the VA is going through some changes right now. They absolutely are, okay? For the better. I think overall, the VA is changing for the better, right? The only negative changes we really see are the GERD and sleep apnea. And sleep apnea is weird because it has that statement of if your coexisting conditions, it says comorbid, if your coexisting conditions keep you from wearing the mask, it's still 50%, right? I'm curious as to what's the criteria for someone to say or get a medical professional to agree that they can't wear the mask due to PTSD or due to night terrors or whatever else, okay? All right. What you hear about Chapter 31 and apprenticeship programs, I'm trying to get some extra tools, materials, and stuff that make me more competitive in my trade. Yeah, Doc, so VeteranAI is an employment program, not an education program. So you have to show that your disabilities prevent you from employment or make it hard for you to hold employment. If that's the case, then you can essentially go to school for free. Right, not using your GI Bill. Greg, I'm a Camp Lejeune Marine back. Oh, my wife just texted me. Hold on, let me look at this. That was funny. I had 2 mini stroke, 2 vertigo attack in 1920. Do I qualify for claim off balance? You still need the big 3, Greg. Right, being a Camp Lejeune Marine doesn't mean anything for vertigo and dizziness, right? So you still need the big 3, the in-service event, the current diagnosis, which I assume you have, and the Nexus. You're going to have evidence from service, whether medical or other, indicating that your vertigo came from service. All right, we got the PACT Act and TERA dispute going on. See, Rady Garka says, hey, what up? Oh, Frankie, my bad. I wasn't paying attention. Okay, I got you, Frankie. I got you. My question was already in. I donated. Could not donate after start typing. Okay, Frankie. Let me look at yours real quick. I want to make sure I get Frankie. Frankie. Where'd you go? Clay, just a reminder, I submitted my question before. Oh, got you. Okay. I can't really... Let me see if I can just word search your name. Evening all, Clayton, thanks for your content, very helpful. I have a question about how to fight getting scammed by an accredited claims agent. I emailed you yesterday. Okay, got it, Frankie. So, one, there's tons of context there, and I would like to look at this. I'm going to sneeze on camera. Whew, excuse me. So there's a lot of context that I need about being scammed. Okay. Ooh, okay. All right, Frankie. Very complicated, all right? Very complicated with you. So essentially, you had a lawyer for a while, and you swapped to a claims agent for whatever reason. That lawyer, depending on how far along you were in the process, is still entitled to your pay, right? Same thing goes for the claims agent. So now that you sign with the claims agent, yes, you have to pay. Now, can you argue that those fees are exorbitant or too high, or they charge you for doing nothing? Yes, you can argue that, okay? And if you believe that your claims agent, there's still a lot of context I don't know, but if you believe your claims agent is doing anything unethical, which you said in your email, I would absolutely contact the OIG and let them know the situation, okay? There's a lot of stuff I can't see within your email, but that would be my advice, is to contact the OIG, put in a complaint, and get their perspective, because they're the ones that are going to be able to do something about it. I hope that answers your question. All right, but the OIG would definitely be my go-to for that. All right, Sergeant Montgomery Mako says, VA physical therapist said today that foot conditions are going up in percentage-wise. Is this true? Not that I'm tracking. I've been gone for 3 weeks, okay? I've been gone for 3 weeks. But not that I'm tracking. That was like the foot conditions were changed in like 2021 or 22, maybe 20, that time frame. So maybe they're just operating on old intel. Who knows? All right, yeah. Coco Random says there needs to be more thumbs up. Absolutely, right. If this is value added, do me a solid. Do other veterans a solid. Hit the like button. I'd appreciate it. Okay. All right, Swamp. Thank you very much for the donation. Appreciate that. If I have multiple claims, will they wait for all of them to be completed until they make a decision? The answer is yes, no. I know that's a bad answer, right? Yep, Frankie, I definitely answered your question. Real short, contact OIG, right? That would be my recommendation. Contact OIG, let them know what's going on, because you used the word unethical. There's some context there that I would question that. But if you do believe it was unethical to be charged essentially twice, then you can contact the OIG, right? Okay, Swamp. Yes, no. Meaning, yes, because depending on the timeline, the VA will just wait for all your claims to be decided, then award you a decision. If they need more time, right? So let's say you submitted 10 claims, they get to 6, and bam, you have a decision ready to go right now, and the VA doesn't want to withhold back pay from you. They will go ahead and issue that 6, and then continue to working on those 4. That will come back as a deferred claim. It's neither good nor bad. It just means the VA needs more time, right? There's absolutely nothing you can do to control that at all. It just is what it is. All right. DMAC Outdoors, thank you very much for the donation. I appreciate that. It says HLR denied for rhinitis. Pre-existing condition, CMP said no aggravation due to no treatment. Statement in support of claims said symptoms during deployment. What direction to go in? So you had rhinitis prior to service, according to this comment, okay? you had rhinitis prior to service, and you had 0 documented symptoms that the condition has worsened. My question to you would be, are your symptoms worse now than they were prior to service? If that's the case, I would do a higher level review personally. A statement doesn't do anything for you. I would like to see documented symptoms, whether in service or current, preferably both. So yeah, it seems like a higher level review, and in the meantime, I would get with your primary care and start gathering that evidence to show that your symptoms have in fact gotten worse, right? And this is all assuming that you had rhinitis prior to service. All right. Okay, let's look at some more questions here. CVB, I see you. I wonder if from breathing in all those fumes and dust and debris from operating the grader, tram, dozer. I never complained in service, but I am diagnosed with rhinitis, which out of service, but I get it. No, it's fine. So it would be, I think it was yours was TERA. Let me click on your thing real quick. Yeah, the toxic exposure risk activity is certainly an option for you, CVB. It'd be TERA. Now, all you do is submit the rhinitis claim. The VA will do the rest, okay? But you're gonna have a TERA exam. In the meantime, you could take the TERA questionnaire or TERA exposure screening, whatever it's called, through the VA, and start documenting that evidence as to what you were actually exposed with or exposed to. Okay, Scott Thomas says, if I have a low rating on back and neck pain injury and it gets worse over time, can I get a higher rating? You can, assuming that you meet the criteria for the higher rating, okay? I have videos explaining how the spine is rated that you can check out. Matt Dancier says, hi Clay, I have a claim for GERD and I had an endoscopy and it was revealed that I have Barrett's esophagus. How does the VA rate GERD in conjunction with Barrett's? I'm pretty sure they are the same thing as far as VA rating purposes go. I'm not 1,000% sure, so let me just take a look real quick. Is that in the new one? Barrett's. Yeah, I believe that's in the new one. And I'm pretty sure it's the same. Esophagus, stricture of, spasms. You're gonna have to look up 7203, 7203, 04, and 05. 03, 04, and 05. That's current. I know Barrett's is on the new rating schedule for GERD as well, so you have to check that out. All right, Jeff says, found this from 1999. You think this is still open? Never got the appointment. You'll be notified by a separate letter of date and your time hearing is scheduled. Jeff, I ain't got no idea what you're talking about. I assume you mean the board, and something went wrong there. Michael Bryan says, how do you get diagnosis if your meds were started years ago through different docs? If you have medication, there's a paper trail. You essentially have the diagnosis somewhere. All right, Durin 300 says, after you file a supplemental with additional evidence from higher level review denial, can you file another higher level review? Yeah, so you do a higher level review, you're denied. You do a supplemental, you're denied. You can do a higher level review on that supplemental, okay? You can keep going back and forth. Then, of course, you can go to the board if you want. Totally your choice there. That's when I would start looking at the representation, FYI. Okay, we have a Frankie Val. Thank you very much for the donation. Oh, yeah, Frankie, thank you. Seriously. Thank you, man. Thank you. All I do is answer questions. Okay, that's it. That's easy peasy, lemon squeezy. Dirt Turkeys, thank you for being a member for 2 months. Appreciate that. So I just found out I had radiculopathy in just my right leg from herniated disc. Is there anything else I can claim? Yeah, so there's a lower back claim in there somewhere. You have radiculopathy in your, what was it, your right? In your right leg. I'm curious as to the radiculopathy in your left leg. Okay, it's not. I'm not gonna say it's rare to only have one side nerve damage. It definitely happens, but I'd say it's uncommon, right? I'm curious as to how the sciatic nerve damage is only to your right leg. How I would claim both, personally. As far as other nerve damage, I would look at your femoral nerves, okay? You can get those rated separately as well. All right, Stevie B says, so the TERA questionnaire is on the VA website and you call a coordinator. So you do the, they probably changed it since the last time I PACT Act exposure exam. Actually, let's do, it's called toxic exposure screening. VA, they probably changed it since last time I talked about it, so let me just re-educate myself real quick. Okay, if you Google toxic exposure screening VA, the very first link is a fast facts for toxic exposure. It has everything you need to know. It has links to go ahead and start that. That's what I would do. But yeah, you can go ahead and register for that and get that rolling, and that could be used as evidence for your claim. I actually might do a video on that. Thank you. It's a good idea. Okay, I'm probably going to give this 2 more minutes, and then I'm gonna head out, guys. Head out for the night. All right. Let's see. William Henry says Navy have good diagnosis for. Oh, just went away. Okay. Blood Raven King says, how would I go about getting unemployment? I'm at 100% P&T with PTSD. You're already 100% P&T, right? You're talking about Social Security. That's its own beast, okay? And you can go that route. But as far as VA goes, you're P&T, man. Unless you rate higher SMCs and you're on the high SMC scale, not the low SMC scale, then sure. HL, can you qualify for clothing allowance for wearing night splints for your plantar? Maybe. Okay, I don't know what a night splint is, to be honest with you. Oh, maybe, especially if it like causes tears or you need bigger sizes. Oh, that looks like it sucks. It says it relieves pain, but I feel like it would suck. The question is maybe, okay? I would honestly just submit for it, let the VA do VA stuff. So you have L5S1. No. So when it comes to the lower back derp, especially because you're on a BDD, just claim lower back. All the diagnosis, and there's a buttload for the lower back. They're all gonna be roped into one, right? And you have cervical spine, which is your neck. Cervical, you have thoracolumbar, which is your middle. Then you have lumbar. Your middle and your lower spine are the same for VA rating purposes than your cervical. So anything in here, you could have 30 different diagnoses for your lower back, and I would still claim lower back. Okay, the VA is going to do VA stuff. You're probably going to be rated on range of motion versus incapacitating episodes, I'm going to assume you're not prescribed bed rest. It's not that common. Yeah, so you're probably going to be rated on range of motion, which is totally normal. Like 98% of all back claims are range of motion based. And with range of motion, you can also get radiculopathy. Food for thought. Okay. Last question I'm going to answer is Stevie B's. Thank you for the donation. I appreciate it. And then I'm going to hop off here. So thank you very much for coming to the live stream. Appreciate it. If you liked it, hit the thumbs up. If not, tell me I suck or whatever. Okay. So Stevie B says, is it smart not to exhaust the post 9/11 GI Bill education benefit if you're not 100% service connected? I know some education benefits won't matter. Yes. So it depends what you're trying to do. So for instance, if you're able to do VRNE, which is chapter 31, do that first. Okay. You can still do VRNE after the fact, even if your GI Bill is dead in the water. You just won't get the housing allowance for that. That's its own thing. But if you have any amount of GI Bill left and you do VRNE, you can still do school for free and get housing, right? But generally speaking, because you're ahead of the game, if you do VRNE first, that's the play, because then you can use your GI Bill for whatever it is you want to use it for, or not. Totally your choice. That's kind of the one over the world for that, Stevie. But hey, thank you very much for coming to the live stream, guys, especially, and gals. Everyone who donated and became a member, thank you very much. Seriously, I appreciate it. My family appreciates it. And with that, I'm going to hop out of here. So let me see if I can do this correct this time. All right, see you later.